All right.
Okay, well, thank you for having us here this afternoon, Kat, and special thank you to Avanitas. My name's Stephen Rubacaba, and I work with the Health Insurance Counseling and Advocacy Program, which is a whole lot to say, so it's commonly referred to as HICAP across the state of California. And today, we're here to inform and educate y'all that may be new to the Medicare world. So, those who are perhaps approaching the age of 65 years old, which is when we're essentially eligible to enroll into Medicare. Maybe you're past the age of 65 and perhaps you're still working and covered by your work group health plan. Or maybe you've been in Medicare and you're just here to kind of learn a little bit more about it, which the material that I'll be going over today can apply to anybody. If you're interested in learning about Medicare, but it is tailored to folks that are brand new to Medicare, but there will be value for all. And let's see if we can go ahead and advance this. And the one thing I wanted to mention real quick also is the PowerPoint slide deck you'll be seeing here today. And some other materials that I'm going to review is all going to get emailed out to y'all after this presentation. So rest assured, all of the materials I'm going over, all the phone numbers, all of the website addresses is all going to get sent out to you. The links that will be in these slides you'll be seeing are active and live in the materials you'll be getting. So you don't really have to write anything down or scribble anything down. We're going to get all that material over to you afterwards. And once we get this presentation going, we'll try to move through it uninterrupted. And then at the very, very end of the presentation, just like Kat mentioned, we'll go ahead and open it up for an open forum for questions and answers. And I also have my colleague, Stephanie Thompson, who's been with this program and organization for many, many years, over 10 years now. So she is certainly an expert on Medicare topics. So I'm glad to have her here today. And again, thank you for joining, Stephanie, and all the folks here. By all means, please feel free to type in a question in the chat feature. If you're afraid you may forget that question, feel free to use that Q&A feature as well. And Stephanie, I'm going to do her best at answering those questions, but for sure, we're going to have open Q&A at the very end. And let's see. And the organization I'm a greater part of, so the HICAP program is housed under a nonprofit organization called Sourcewise. We've been in the community since 1973. And one of our goals is to provide expertise, education, and essentially quality support services for all of Santa Clara County seniors, their families, and their caregivers. And some of our internal other programs that we have, in addition to HICAP, we have an information and awareness team that is extremely knowledgeable on all types of programs and resources in our county. As a matter of fact, that's their main objective. That's what they are supposed to do, is be aware of all the programs and resources for folks. If we don't have a program in-house, we definitely have the contact information for that program if it exists. For example, folks need help paying some bills from time to time. People need help getting some food inside of the house. Folks need help getting maybe some, type of equipment to get around the home. But they're aware of all types of programs in our county. So it's a good place to start. If you need help, reach out to our information and awareness team. Very friendly, very knowledgeable, and are there to sort through all the programs for y'all. We also have a care management program or team, which is, it's a customized solution to help Medi-Cal eligible seniors age well at home. So for folks that aren't able to maybe sign up for all these other programs in our county, our care management team or multi-senior service program or MSSP caseworkers can help folks get on track and find the help that they need, because it's a lot of work going out, applying for IHSS, applying for food help. Our care management team helps folks do that. We also have a senior employment program, which their main function is to train folks who are interested in getting back into the workforce. So they do provide various training courses. They even pay out stipends for folks that are taking those courses. And then they help usher these people back into the workforce, whether it be at a full-time level, a part-time level. So we do have a senior employment and training program. We also in-house have a Meals on Wheels program, which essentially provide nutritious meals designed with the senior diet in mind, and they're delivered right to those folks' front door. They receive a weekly supply of meals, and one of the eligibility criteria is, folks have to be homebound to receive Meals on Wheels program, and they have a handful of other criteria. But the final program that we do have in-house, which is the organization or program I work with, called Health Insurance Counseling and Advocacy Program. Again, commonly referred to as HICAP across the state. So we are the location for Santa Clara County residents, or we are the organization and program for Santa Clara County residents. We have just under, let me think about this, we have just under 40 state certified HICAP counselors. And we're typically stationed all throughout the county. So we have very strong partnerships and very long partnerships with some of our public libraries, some of the community centers, senior centers, health centers, similar to Avenidas, all around the county. And typically we do these outreach presentations in person, and we typically do in-person one-on-one counseling sessions also in person. And mind you, all these services are free. But with COVID, we've been unable to do a lot of things in person, as I don't need to remind folks about that. But one thing I wanted to tell y'all is that the HICAP program in California is a part of a greater network called the State Health Insurance Assistance Program, or SHIP program. That itself is a federal program, which is across all of the United States, although a lot of states, or maybe I should say a handful of states, decided to call it something different. So California likes to switch up the names of all the programs. It seems like instead of Medicaid, we call it Medi-Cal. Instead of the SHIP program, it's called HICAP. But I wanted to let y'all know that in addition to these outreach sessions that we're doing here, we certainly offer one-on-one counseling appointments. Again, they're free. All of our state certified counselors, we give objective and neutral information. We don't represent any insurance company, any insurance agent. And we would certainly encourage you to give us a call if you have any follow-up questions or you do want an appointment. Now I'm going to unpack a lot of material today. I don't expect you all to be experts on Medicare or know for certain how you're going to handle your Medicare benefits. So I'd encourage you, if you are, approaching the Medicare eligibility age of 65, our counselors all day long, all the time, do one-on-one counseling for folks that are brand new to Medicare. And I would encourage that you speak with somebody who is objective in those efforts. Now, maybe you're a resident of another county. Maybe you know somebody who may need these services who live in another county. There's a telephone number here above, which will automatically route you to your local HICAP office. For folks that are out of state, again, they do have these services all across the nation. They can simply go to the medicare.gov/contacts, and it will direct them to their state and county SHIP program or office. Okay, so now that we got some of that house cleaning out of the way, I'll go ahead and dive into some of the parts of Medicare law. And these parts that you see above are all officially written into law. And Medicare, as it was created back in 1965, consisted of only two parts. Part A, which is our hospital insurance, which covers, if we were to get hospitalized and be admitted as a patient in a hospital for whatever reason, Part A is going to pay for that. We also have our Part B Medicare insurance, which essentially is the medical component of it, which is, all outreach type of services. Maybe you need to get some blood or some lab work. Maybe you're just not feeling good and you want to go talk to a doctor or a licensed physician. That's all going to be paid for by our Part B Medicare insurance. Now, a lot of Part A and Part B, as it was designed, it's not 100%. It's not going to pay 100% of everything. Typically, it pays approximately 80% of those services and treatments. The remaining 20% is up to us, the beneficiary. So as is Part A and Part B, typically pay 80%. Fast forward a handful of decades, the federal government created or wrote in the law what was called Part C. Now, Part C is called oftentimes a Medicare Advantage option or Medicare Advantage route. All of these Medicare Advantage plans, beginning in 1999, is when they were allowed to jump in this market. So Medicare Advantage plans, or Part C, they're all sold by private insurance companies. And the way that the law was written is what they told these insurance companies is, okay, we'll allow you to jump into the Medicare market. At minimum, you must provide all the services and treatments that are written in the law of original Medicare. And I'm going to go into a few of those in a little bit. Now, one of the fourth components about Medicare, or that was written in the Medicare law, which was shocking to me when I learned this, was our prescription medication. So way back in 1965, we didn't have any prescription drug coverage. If we had to take prescription medications, we had to pay 100% out of pocket. Part A and B did not pay for that. Medicare Advantage plans, on the other hand, a lot of them nowadays, they include prescription medications. So Part D works in conjunction with Part A and Part B, at least a standalone Part B drug plan. But in a high-level nutshell, these are the bulk of the components of Medicare. Now, let me tell you how we get enrolled into Medicare, because a lot of folks think it's automatic. Some folks think it's not automatic, and they're both right. And now let me explain to you why they are both right. So we will automatically get enrolled into Medicare if we are receiving Social Security payments before we reach the age of 65. So again, I'll repeat, if we are receiving Social Security payments before we turn 65 years old, enrollment into Part A and B is automatic. You're going to be getting your red, white, and blue Medicare card roughly 3 months prior to your 65th birthday month. Okay, so those will arrive in the mail automatically. And one way that it's not automatic is, guess what? Yeah, if you are not receiving Social Security payments before the age of 65. So for folks that have opted to not sign up to receive Social Security payments before they turn 65, will not automatically be enrolled. So you have to take action, right? Now, how do you enroll into Medicare? You don't call up Medicare. We don't go to a Medicare office. There's no such thing, strangely enough. We all begin our journey and enrolling into Medicare through Social Security Administration. So the Social Security office is going to handle our initial enrollment into the Medicare world. So we can enroll nowadays by going to ssa.gov. We can also mail our Medicare application to one of our local offices. You can find an office here. There's a bunch of them in Santa Clara County. You can fax your application in. You can call and attempt to do it online, which can be a little bit tricky, or excuse me, you can call and attempt to do it over the phone, which can be a little bit tricky, but it's certainly possible. The easiest way, in my opinion, is nowadays online. You can enroll online nowadays. You could download the app and submit it to your local office. And by the way, you do not have to be retired in order to enroll into Medicare. Medicare is based on one thing usually. It's based on our age. So if we once we turn 65 years old, we're eligible for Medicare. What we pay for Medicare is a different story. So that is how the enrollment into Medicare works. The first time we can enroll into Medicare, we can't enroll, 6 months before we turn 65. It's too soon. We can't enroll when we're 60 and plan ahead. Trust me, I'd like to plan ahead and, pick my enrollment sooner rather than later. But we have 7 months to enroll into Medicare. When we are first eligible to enroll, we will be in what's called our initial enrollment period, again, which is a 7-month window. Sorry if that's hard to see. And the 7-month window is 3 months before our 61st, 3 months before our 65th birthday month, right? We could enroll into Medicare. We could reach out to Social Security and start our enrollment. The month that we turn 65 years old is considered our 4th month. And then the 3 months afterwards are the final 3 months of our initial enrollment period. So we have some time to make some decisions on how we want to enroll in our Medicare and how we want to handle those affairs. I would encourage you that are here today, if you're about to turn 65, 3, 4, maybe even 5 months down the line, maybe you're past the age of 65 and you know when you're going to retire, give us a call and set up a one-on-one counseling appointment so we can pour through every single one of your options and then you can make an informed decision. But 7 months total, I encourage people to start thinking about this at least 3 months before you turn 65, even if you're going to continue working. Start looking into it. You don't want to wait to the very last minute. Now, you may be asking yourself, okay, well, I could enroll in any of those 7 months. When's my insurance going to start, Steve? Which is a good question, right? We want to make sure that we're covered. We don't want to have any break in our insurance coverage. It'd be very dangerous for us. So if we choose to enroll into Medicare in our first 3 months of the initial enrollment period, and I'm just going to go ahead and try and call this IEP, okay? If we enroll in the first 3 months of our IEP, our Medicare insurance will become effective on the first day of our birthday month, right? Let's say we delay a little bit and we make our decisions the month that we turn age 65. The effective date for our Medicare starts the first of the next month, so a little bit of a delay. Again, we want to plan and make sure there's no break in our healthcare coverage. Now, if you wait even longer, you'll see based on this chart here, the longer you delay your Medicare enrollment, the later the effective date becomes, which again, it puts us at risk of perhaps not having any healthcare coverage unless you're really planning these effective dates wisely. So the longer you wait, the later it's going to start to become effective. Something to keep in mind, it's not always going to start the next month. It's not always going to start when you want it to start. You know, the federal government has their own rules and their own timelines, so this is helpful for us to know when things will become effective. Okay, so this is the first time that we're eligible to enroll is our IEP, which surrounds our 65th birthday month. Now, let's say you want to delay your enrollment, right? Which a lot of people do for a handful of reasons. Now, a lot of folks call me and go, hey, Steve, you know, I turn 65 next month. My first thought is, uh-oh, I wish you would have called me sooner, right? But then they quickly tell me, well, I'm going to retire in a year or two. What do I do? Do I need to enroll into Medicare? And the answer is, well, you have a choice. You could enroll into Medicare if you wish, or you can delay it. As long as you are enrolled in an employer group health plan or a union group health plan, due to active employment, due to you working past the age of 65, you can delay your Part B enrollment. There's no late enrollment penalties because you have creditable, health insurance coverage through your group health plan. Now, the one thing I want to remind folks here is that your group health plan enrollment must be due to active employment by either yourself. And by the way, let's say I turn 65 next month and I retired last month, but I've been covered by my spouse's group health plan. It's the same thing. If I'm going to be covered by my spouse's employer group health plan past my age of 65 years old, I can delay my enrollment and wait until my special enrollment period. So it's not only due to my employment, but due to my spouse's also. The one thing I wanted to point out is that COBRA does not count. If you extend your group health plan through COBRA, it's not going to count because you're not actively employed, right? So again, you could enroll anytime while working past age 65. past the age of 65, and you have roughly upwards to 8 months after the month that your employment ends or your employer coverage ends, whichever happens first. So let me see if I can summarize here. The initial enrollment period, real quick, is for folks that maybe are not covered by a group health plan. You want to make sure you try and take action during your initial enrollment period within that 7-month period. Otherwise, we may face late enrollment penalties. Or if you're going to continue working past the age of 65, or your spouse is going to continue working past the age of 65, and you're covered under their group health plan due to active employment, you can delay your enrollment for your Medicare. Okay. Now, we don't want you to miss your special enrollment period if you're granted one. Remember, not everybody has a special enrollment period, but there are a lot of people that miss these timeframes. They miss these windows, right? And that's okay. The first opportunity is our IEP. Second opportunity is our special enrollment period, or SEP. One of our final opportunities is called the general enrollment period, or GEP. And that happens every year, which is a little bit easy, because it's a fixed date on a yearly calendar. So the GEP runs from January 1 through March 31 of every year. But get this, if I miss my IEP for whatever reason, maybe I was healthy for a long time, maybe I missed my SEP, because again, maybe I felt healthy and I didn't want to pay for the Medicare, and maybe I get ill, and now all of a sudden, I can't even enroll in the Medicare when I want to. I must wait until January 1 through March 31st. Now, depending on the healthcare condition, the treatment isn't going to wait. So please try not to find yourself in the general enrollment period window, because there certainly is going to be a delay of coverage, and perhaps you've already had a break in your healthcare coverage, and we don't want it to be any longer, right? So the general enrollment period, January 1 through March 31st, coverage will begin July 1st of that calendar year. You may possibly have permanent premium penalties. The Part B premium will be increased 10% for each 12-month period delayed. So there will be late enrollment penalties for Part B enrollment. You may have late enrollment penalties for Part A if you have to pay for Part A. And I'll get into folks that may have to pay for Part A insurance and folks that don't. To let you know right now, the majority of folks receiving Medicare benefits do not have to pay anything for Medicare Part A, because they've contributed to the Medicare program throughout their life and throughout employment taxes. But one of the other opportunities is our GEP, which I don't want any of you to fall into that category, but it is there as a safety net to help us, right? So those are just some of our opportunities on when to enroll into Medicare, which is kind of a lot, right? And now we're going to try and talk about the options that we have. Okay, it's not like we sign one paper and boom, we're Medicare covered, everything's good. We have to make decisions. We have to make choices, and they can be difficult, right? So the next handful of slides, I'm going to go over the two options that we all have in how we're enrolling into Medicare. We don't have a million different options. We have a lot of choices within these two options, but we have two options to choose from. Okay, so option one is enrolling into Original Medicare Part A and B, which is simply this red, white, and blue card only, which covers us for our hospital coverage, inpatient coverage, and it covers any outpatient type of care, doctor visits, these kinds of things, right? And remember, Part A and B, for the most part, only pays 80%. 20% of a hospital bill can be tremendously expensive. I do not want to know how much it costs. More than likely, I'm not going to be able to afford it. So most folks protect themselves and purchase what's called a Medigap plan. A lot of the times it's referred to as a supplemental plan. And then to make sure that we're fully covered, we sign up for a standalone Part D drug plan for our prescription medications, right? Now, in this model, the original Medicare, traditional Medicare, I hear a lot of folks referring to it as fee-for-service Medicare, and I'll let you know what that means shortly. In this model, we could essentially go anywhere we want to in the country that accepts Medicare assignments. So there's not necessarily a network that we have to stay within. If I want to see a specialist at Stanford, if I want to go see a physician out in Florida or New York City, I can go and see them as long as they accept Medicare assignment. I don't have to get permission from anybody. I just make that appointment. And one thing I'll share with you briefly is the other option that we have is joining a Medicare Advantage plan, which again, I mentioned earlier, as written in the law, it's called Part C. So Medicare Advantage plans are all sold by private insurance companies. They essentially have an HMO type of model, health maintenance organization. So what does that mean? It means you have to stay in their network, right? It means they may have a smaller network of physicians that is more concentrated, and you have to stay within their network. You have to go to those medical groups, go to those physicians that accept that Medicare Advantage plan. And right now in our county, this year, I should say, there are 55 different Medicare Advantage plans to choose from. That's 5. All but one of those plans include prescription drug coverage. They all have, they all have various co-pays, co-insurance for pretty much everything. So in a nutshell, the first option, which is traditional or original Medicare, you could almost, you can go anywhere you want to across the country. You don't necessarily have to stay in a network, although for option 2, you do have to stay within their network of doctors and their network, their network of hospital groups. Now, the reason I kind of gave a long-winded, well, it wasn't that long-winded, but I tried to give more information about these 2 options is because as I go over these 2 options, I want you to ask yourself something, because folks ask me this all the time. Steve, which is the better option? What should I do? Should I go with original Medicare, Medigap Part D drug plan, or should I go for the one-stop shop type of model and join a Medicare Advantage plan? What should I do? And my answer is always the same. It depends, right? Now, what does that depend on? Here's what I would ask you to ask yourself. The doctors and physicians or specialists you're seeing right now, assuming none of you are on Medicare, are they going to be in one of these Medicare Advantage plans, right? Are all my doctors in one single plan? Are all my doctors and specialists going to take original Medicare? How much are some of these co-pays and co-insurances going to add up to in Medicare Advantage? Am I going to purchase a Medigap plan that will help pay for those out-of-pocket co-pays, co-insurances, deductibles, so on and so forth? So it's always a balancing act in how we want to manage our risk. To manage our risk, it costs money. And it always boils down to resources. How much do we have and how much can we afford for the most robust coverage, okay? Now, I don't know if that was a good way of asking that question, but I'm gonna go over some of the differences in more detail in original Medicare, and then I'm gonna go over the Medicare Advantage option differences, okay? And I may have covered some of this already. So original Medicare, we can go to any practitioner or use any hospital, nursing facility, home health, or hospice agency, as long as they accept Medicare within the United States. The treatment and services that we're getting, certainly it must be medically necessary. We can't just go and ask for some type of treatment that isn't necessary. It's not needed. So again, this is not an HMO type of model where a network or a primary care physician or medical group assignment is required. Now let's go over in detail some of these services here. Excuse me. So again, briefly, I mentioned that there's Part A. So again, inpatient hospital care, skilled nursing care, limited home health care, hospice care. For these services and treatments, there are deductibles and copays, right? For Part B insurance, again, our outpatient care, physician services, annual wellness visits, preventative services, diagnostic lab work, blood work, some therapies, and even our durable medical equipment, wheelchairs, grab bars, something of that sort. Some things that are not covered by Medicare, which some of these items were startling to me when I first joined this program some time ago. Long-term skilled nursing home stay isn't covered. Routine dental care isn't covered in original Medicare. Dentures, vision, hearing aids, cosmetic surgery, unless it is, physically needed, in case there's some incident or accident that maybe somebody has been in and they need some type of cosmetic surgery, but not just any old cosmetic surgery for us if we're interested in that. Acupuncture isn't necessarily covered unless it's specific to lower back pain. That was just recently allowed. Hearing aids and exams, which can be very expensive. And by the way, care outside of the United States is not covered by original Medicare. So these are just a handful of things that aren't covered. The complete listing of services that a lot of folks think are covered that are in fact not covered can be found on medicare.gov if you're ever curious to check that out. And now I wanted to get into some of the costs of Medicare. Now, earlier I mentioned that there may be a cost associated with our Part A hospital insurance of Medicare. So most of us that are receiving Medicare don't have to pay anything for Part A. We call it premium free. You don't pay anything. You may be asking, well, how come we're not paying anything? This sounds great. Well, it's because we have worked and contributed to our FICA taxes roughly about 10 years in our lifetime. So we need to obtain what's called 40 Social Security credits. And we could earn 4 Social Security credits in a year. That's the maximum amount we could earn, as long as we are earning in wages at least $1,410. Then we earn 1 Social Security credit. So me, I have already earned my 40 plus Social Security credits. By the time I reach 65, in theory, if the laws don't change, I won't have to pay anything for my Part A. Now, there are folks that for whatever reason, they didn't earn those 40 credits. So they have to pay something, right? They have what's called the premium Part A insurance, and it's not cheap. So anybody that has earned between 30 and 39 Social Security credits are going to pay $259 a month just for their Part A insurance, okay? If they've earned less than these 30 Social Security credits in their lifetime, it jumps up to almost $500 a month just for Part A insurance. Now that's expensive. Now, for folks, I don't want you to get scared by these numbers. Maybe you haven't earned these credits. Don't be worried. For folks that are receiving a Medicare Part A right now, and they have 39 credits that they've earned, so they're paying this $259 a month. If they're able to, they can earn and acquire these extra Social Security credits to drop that premium down. So if I'm 67 years old and I've been paying this premium and I really want to get rid of it, if I'm able to work and earn at least $1,410 in a year, then I could earn that 1 final credit that all of a sudden turns my premium into premium free Part A. So you can still continue to earn those credits past the age of 65 is my point of that. Now, you can still earn these credits past the age of 65 years old. And I'm going to get into a little bit of these costs here as well. And there's a reason I'm getting into these costs, right? So for those of us who, regardless if we have a premium for Part A or we don't have a premium, we're all going to have to pay these fees up here somehow or another. So when I get admitted into a hospital between 1 and 60 days, I'm going to have to pay $1,484 as my deductible Ouch, that's expensive, even just for one day. Now you can see if we're hospitalized for longer than 60 days, 61 to 90 days, now all of a sudden I have to pay $371 per day, which is the copay. Now, I don't know about you, but these prices are adding up very, very quickly. And you can see the more days I'm hospitalized, the more expensive it's going to get. All right. Just a little bit more. Even if if I have a skilled nursing facility stay, here are some of the costs associated with that, right? So again, it's starting to add up. You may be asking, well, how are we going to pay for this stuff? And I'm going to go over on how to protect ourselves when we join original Medicare Part A and B to hopefully not get hospitalized for this long. And not have to stay in a nursing facility. But again, we want to make sure we are covered if in fact that does happen without having to pay all that money. So I'm going to explain how we can help absorb all of these costs here. The answer is by purchasing a Medigap plan, by the way, which I'll go over later. So that was just costs associated with our Part A insurance. Now, let's go over some of the costs associated with our Part B insurance, the outpatient insurance. We need to go see a doctor when we're not feeling well. Everybody has to pay for Part B insurance some way or another. Everybody, there's no way around it. For Part A, a lot of us don't have to pay as far as a monthly premium, but for Part B, everybody has to pay a monthly premium. And it's all based on our income, our annual income. So most folks in Medicare, if we are earning $88,000 or less in a year, and we are filed as a single person, as in not married, the base fee is $148.50 per month in the year 2021. This monthly premium for Part B, just like everything else, goes up every year, goes up roughly 2% every year. Now, if I'm married, the income levels are $176,000 or less. Both me and my spouse have to pay the $148.50. Now you can see here, as the higher income earners, as folks make more income, I guess is what I'm trying to say, in a year, they have to pay a little bit more. There's a income-related monthly adjustment, which is a fancy way that the federal government says, okay, higher earners, you have to pay an additional in this row or category at least. And I'm sorry, this chart isn't the most intuitive, but for higher earners earning more than $88,000 a year, they have to pay in addition to $148.50, $59 and some change, which brings their monthly total to $207 and some change. Now, again, they have higher brackets. The higher the bracket that we're in, the more that we are obligated to pay for our Medicare Part B insurance, okay? Just to let folks know. And in addition to that monthly premium cost, we also have to pay an annual deductible of a couple of $100, $203 in 2021. We also have to pay roughly 20% co-insurance for most services. Again, most services, physician costs, hospital care for outpatient, durable medical equipment, ambulance, some therapies. This is that roughly 20% cost. So I don't know about you, but in my mind, these possible bills are just adding up to a ridiculous number that I'm afraid that I'm going to have to pay. So you can see all these fees, deductibles, co-pays, they all start to add up. And that's where the Medigap or supplemental plans came into play and came into existence. They're going to help pay some of these out-of-pocket costs that we would otherwise be stuck with paying, right? And then to make sure we're fully covered, which I'm going to talk about in a moment or two, is our Part D prescription coverage for any prescription meds that we get prescribed. So I did mention all of these costs. Let me go back here. How many clicks is it? So for some of the higher earners, they have to pay more money into the Medicare system. On the other hand, there are programs available for us that are called Medicare savings programs that help with some of those costs. So for those that are on the lower spectrum and low on resources, they get help. They don't have to pay any addition. There are programs that help folks. So obviously Medi-Cal does coordinate with Medicare, just to be very clear. Now, for folks that are on Medi-Cal, until they turn 65, that all changes. Medi-Cal will be paying most of the bill. Well, Medi-Cal is going to be paying 100% of somebody's healthcare services or treatment. Once they turn 65 years old, Medi-Cal becomes a secondary. So they're only going to be paying roughly 20%. And then the federal government pays, like I said, that 80%. But Medi-Cal can help pick up all of those, a lot of those out-of-pocket costs. I'm talking the Part B premium. I'm talking some of the co-pays, the co-insurance. Now, these programs here, there are some folks that they're not eligible for Medi-Cal because they earn, quote, too much in a year, right? And too much is subjective, but the feds have a federal poverty level. So that's what we have to go by. Folks that are not eligible for full Medi-Cal, they can qualify for these Medicare savings programs, the QMB, qualified Medicare beneficiary. I mean, there's a few of them that are offered that help pay some of those costs. So if you think this might apply to you, if you're like, wow, Steve, these costs sound out of control, I'm never going to be able to afford this. I'm on Medi-Cal now, I'm never going to be able to afford this. What should I do? If you think these programs may apply to you, if you are lower on resources, give us a holler. We can go through it. We know the rules. We know the income brackets on where folks will be eligible for these programs. If you're slightly above these income brackets, there are methods to lower your countable income so that you can be eligible for these programs. But I just wanted y'all to know that they do exist and they do help pay these out-of-pocket costs for Part A and or B. So give us a holler if you think you may be eligible for some of these. Or we can even talk about it when you make a one-on-one appointment to talk to one of our counselors because you're going to be new. Okay, so let me kind of summarize right now. I think I'm running a little bit behind schedule. So thus far, we've talked about the various enrollment periods, right? The initial enrollment period where you have 7 months surrounding your birthday month. If you continue working past the age of 65, you will be in what's called your special enrollment period, your SEP, and you have under 8 months to make your Medicare decisions in your SEP. If you forgot or life got busy and you missed those 2 opportunities, you can sign up during your GEP, which runs every year, January 1 through March 31. Your Medicare insurance will become effective in July. I've gone over original Medicare parts A and B. Some of the takeaways I wanted y'all to know is premium-free Part A Medicare insurance, right? What it costs if we do have a premium for Part A. I talked about Part B, like boy, what some of those costs are. And I briefly mentioned some of the Medigaps, right? Or supplemental policies. These are going to help fill in those gaps, right? These 20% that we have to pay, all these co-pays, the co-insurance for hospital stays, we saw those numbers. Now, these Medigap or supplemental plans, they're a way to protect ourselves from paying that out of pocket, right? So they're going to help manage some of our risks. And you may be asking yourself, well, what's a supplement plan? I think I heard of Medigaps, but I really don't know what it is, which is understandable. So a Medigap or supplemental plan is an insurance policy sold by private insurance companies. So some of the prices for these plans, well, they're all over the place, right? So some of these Medigap companies, they may use health screenings before they sell you their products, which is quite okay. They can do that and they can deny selling us a Medigap policy, but we do have certain protections where they cannot ask us any health related questions. During our initial enrollment period, there's a window of time where they are not allowed to ask us any health conditions and deny us a Medigap plan based on that. There's a small window of our SEP, special enrollment period, where they're not allowed to ask us any health related questions and deny us a plan. So And California has some additional protections also that the rest of the US is not privy to. So there are protections to buy Medigap plans without them using health-related screenings. Well, what do? The biggest thing that Medigaps do is they're going to pay our Medicare Part A and B out-of-pocket deductibles and copays. Now, there's a handful of Medigap plans. So they're sold by private insurance companies, but they've all been standardized by the federal government. Now, what do you mean by standardized, Steve? Well, by one, they've named them. You know, they have names for these standardized Medigap plans. So they have a Medigap Plan A, Medigap Plan B, Plan D. You can have a Medigap Plan C. Does that sound familiar? It probably does, but please don't get Medigap Plan A, Plan B confused with Medicare Part A, Part B, D, C. Don't ask. I don't know why the legislatures wrote these laws using this language. I mean, Medicare is already confusing. So this makes it a lot more confusing. So let's just try not and get confused by a Medigap Plan A and Plan B with Medicare Part A and Part B. But they've all been standardized. In order to purchase a Medigap plan, you must be enrolled in the Medicare Part A and B when you apply, or at the time of your coverage, I should say. Now let's take a closer look at the standardization of these Medigap plans, okay? Let me see if I can get into this. So wherever you see, you know what, let me just, I'm gonna pull up the insert. So like I said, we're gonna mail you all these materials, the slide deck you're gonna get. I'm gonna send you our Medicare consumer guide, which has all the costs on Medicare Part A and B. I was talking about all the costs on Medigap's Part D plans, Medicare Advantage plans, all of the options for Santa Clara residents I'm gonna be giving you. And I'm gonna see if I can pull up this Medigap insert so I could explain it just a little bit better. Bear with me here. Okay, here it is. Okay, so this is the insert for Medigap plans that I'm gonna send y'all. So now, let me see if I can zoom in just a bit. So now remember I was talking about some of those Part A co-insurance, you know, when they charge us by day, they charge us days 1 through 60, 61 through 90. Now check this out here. So a Plan B, if you notice this little dot here, is going to cover our Part A hospital inpatient deductible days 1 through 60. So all of these plans across here, they're all going to cover this deductible. But you may notice Medigap Plan K and Plan L, they only pay a percentage, right? And you'll see, you know, all of the plans, all of these Medigap plans are going to cover our Part A hospital coinsurance days 61 through 90, which is going to save us $371 a day if we were to be admitted into a hospital for that long, which is very helpful. So it is safe. Now let me scroll over here. So a Medigap Plan A, you can see there's not that many dots, right? So it does have some protection and it does have some coverage, but it's not going to cover everything. So it's not going to cover our skilled nursing facility stay. It's not going to cover foreign travel. Now, remember, original Medicare Part A and B, it's only for services within the US. There are certain Medigap plans that have that will cover outside the US for urgent or emergency services only. Now, there's a handful of plans that will cover that for us. Okay. Now, getting back to all of the plans are standardized, right? And I want to kind of elaborate on what I mean by they're standardized. So let's say Steven has a Medigap company that sells Medigap Plan A's, and then Kat sells her Medigap Plan A's also. Now, the federal government says, okay, Steve, okay, Kat, you're all going to offer the same services. You're all going to pay for these out-of-pocket costs, right? Period. You're going to pay for it. But me, Steven, I get to choose the price I'm going to charge you. Kat gets to choose the price she's going to charge you. Let me show what I mean by that. And by the way, the Medigap rates and charges, it's typically based on our age and the zip code that we live in. So this chart here is based on my organization's zip code, and I kind of put in generic ages. So somebody age 65 wants to buy a plan A from Aetna, it's going to cost them $152, right? The same exact plan, same exact coverage. Remember, they're going to pay the same thing. They're going to charge me $123. Blue Cross of California, oh, it's even cheaper. They're only going to charge me $100 a month. So my point is, you know, when folks ask me, they go, hey, Steve, well, which Medigap plan? I mean, which Medigap company should I go for? Some folks start choosing the most expensive one. And my response is, well, I don't know why you're going to pay $152 when you can pay $100 through Blue Cross. They're going to pay the same thing. It's the same exact coverage. They're just charging you different amounts of money. Okay. So something to keep in mind, right? They're standardized for a reason. There's just different company names that are selling them. That's it. They're all battling. They all want your business. They all want your money. They're all going to charge you different rates. Okay. So I just wanted to show you that briefly, and let's see if I can get back to the PowerPoint. I think this is it. Okay. So this chart, again, it's for my organization zip code. I kind of did a generic, age. So if you're, 67 years old or 68 years old and you want an exact quote, don't go by the chart that I gave because I don't even have those specific ages. It's just multiples of 5. I have age 65, age 70, age 75. Even if you are 65 or 70, don't go by the numbers in that chart. You want to go through the insurance company directly. And an easy way to do that is all these Medigap companies, by the way, they all report their rates to the state of California, all right? They're obligated to. For up-to-date and accurate rates, you may want to visit insurance.ca.gov, click on the Medicare supplement button, enter in, I think it asks for date of birth and zip code, and it's going to populate, show you the prices for every single Medigap plan company that is selling products in our area and how much they're going to charge you. So there is where you want to get the most up-to-date if you're interested. Okay, so let's go ahead and talk about our Part D drug plan coverage, or standalone drug plan coverage. And briefly, I just want to try and summarize what Medigaps or supplemental plans do. They're private, they're sold by private insurance companies. What they do is they're going to pay our out-of-pocket Part A and B costs, which is, again, roughly the 20% of costs that original Medicare Part A and B is not going to pay for, right? They're going to take care of that for us. They're going to manage our risk for us. But they want us to pay them in order to manage that risk. And some of them could get expensive. Some of the most robust Medigap plans are going to be more expensive than the ones that aren't going to cover that much, right? And it makes sense. So for those that have those resources in their bank account or in their pocketbook, they may want to purchase the most robust Medigap plan available, if they're able to. And even folks that have those same amount of resources, they're like, nah, I'm healthy. I'm going to purchase the least expensive Medigap plan. But just be careful when making those decisions, okay? So our Part D drug plan, let's talk about those for just a little bit. Available to us and to you all right now, you have 32 different prescription drug plans available to you. You do not have to be enrolled in both Medicare Part A or B. You could just be enrolled in one of them. You can sign up for a standalone drug plan, okay? These standalone drug plans, they're all sold by private insurance companies. The prices are, again, all over the place, right? So some of the insurance companies' monthly premium are as low as $7.20 a month to as high as $130.40 a month. That's just the premium. We're not talking about co-pays to go pick up your medications, okay? That's just the monthly premium. The deductibles range from $0 all the way upwards to $445. And similar to our Part B adjusted amount, most folks that are signed up for standalone Part D drug plans, they don't have to pay any additional money to the federal government. So these income brackets may look familiar. They're the exact same ones used for Part B, like boy, monthly adjustment amounts. So for higher earners, they have to pay in addition to, let's say you have, let's say you signed up for the drug plan that costs $7.20 a month. You're paying that to the insurance company. If you're making over $88,000 a year, you're going to pay an additional $12.30. It's not going to the drug company, it's going to the federal government. So you have to pay in addition to that amount. But again, most folks fall in this bracket here. For higher earners, they do have to pay extra into that. And one nice thing is that you can find your own drug plan. It's such a fabulous tool, and I plug this every single time I get the opportunity to. So instead of searching through these 32 different drug plans, and by the way, I have the 32 different drug plan insert for y'all here. Let me show you briefly, since I have it. Drug plans, okay. So here I have all the costs for some of these drug plans. Anthem Blue Cross, Meta Blue RX was $26.10. Deductibles, it goes over all these charges and costs, which looking at this, I might as well look at another language. It might as well be hieroglyphics as far as I'm concerned. I wouldn't expect anybody to look at this and decide what drug plan they want. Please don't do that. What I would encourage you to do is go to medicare.gov and select the Find Health and Drug Plans, and you can compare plans. The federal government stays up to date on all of the standalone Part D drug plans available to us, what you can do. And once you have a Medicare number, you have to have, well, you don't necessarily have to, but I would encourage you create an account in here because you only got to do it once. Now, once you create an account, you could enter in all of your medications that you're taking. You could enter in the dosage amounts, the pharmacies you prefer to go to, and you could compare every single one of those 32 drug plans. And it's going to tell you, it's going to list them. Okay, Steve, this is how much you're going to pay with this company in total. This is how much you're going to pay in a year, right? It's going to do all the math for me. So it's going to show me the least expensive drug plan that I can choose from that's going to cover my medications. And they're going to be available at my preferred pharmacies that I go to. And I can do that every year. Every year, Medicare beneficiaries can change their Part D drug plan in the annual enrollment period, which is October 15 through December 7. Medicare beneficiaries can save hundreds of dollars every year if they just do a Plan D comparison in this website. Doesn't take much time either. Our high cap counselors do these plan comparisons for folks quite often. We encourage folks to create their account on their own. It's quite easy. You need a Medicare number, you need some of your personal information, and you can create your own account. It's a way to take control and truly take power of your Medicare benefits. Make sure you're not getting charged anything funky, make sure there's no fraudulent activity happening, and you can save money every year, possibly. Some of our high cap counselors, they don't just talk about doing drug plan comparisons every year, they do it. One of our counselors last year, we have a couple of counselors, they're married, it's a married couple. One of the spouses is like, I'm not gonna do it this year, I saved a lot of money last year by switching to this plan. I don't have time. His partner, his wife was like, you may want to do a comparison. Let's just do our drug plan comparison. They did one during annual enrollment period of last year. Turns out he was able to save several $100s, upward to $500. The premium hadn't changed for his plan. As a matter of fact, the premium went down for his selected drug plan in the next year, but the co-pays and co-insurance for his medications, those went up. So don't just base a decision on the monthly premium. Base it on what you're going to be paying in a calendar year. Base it on the medications that you're taking. Don't just base it on the premium. So anyways, I would encourage everybody, once you get a Medicare number, if you haven't already, go to medicare.gov, create an account. It's a powerful tool, and we can certainly help guide you through using that tool. As a matter of fact, next month, we're doing a Part D drug plan finder demonstration. So reach out if you're interested in joining. We're doing one in September. Anyway, sorry about that. So let me get back on track. If you want to compare your own plans, you can go to medicare.gov and do your own plan comparison. Very powerful tool. And just to give you an idea on, let me see if I can get back on track. I kind of got thrown off on doing that plug, and I'm sorry. So just to recap, this page is for higher earners. They're going to have to pay more into the drug plan. But just like our Part A and B, there are plans, there are programs that help lower those drug costs. This one is called the Extra Help Program. It's specifically for prescription drug medications now. There are income limits that are associated with that. If you think these income limits may be applied to you, again, please reach out, give us a call. We can go over your options as far as saving you money with either a Medicare savings program or a low income subsidy extra help program. These drastically lower your prescription drug medication premiums. They can essentially eliminate your monthly premium and dramatically lower your copays for generic and name brand medications. So if you think you are lower on resources and are having a hard time affording and paying for your Part D drug plan and medications, give us a holler. We may be able to help. Okay, so I went over a lot of the original care method and route, and thank you for bearing with me. I know we're a little bit over. And now we're gonna wrap up and talk about the Medicare Advantage route, okay? So all of what I discussed in original or traditional Medicare, there's not necessarily a network. You can go anywhere in the country. Your Medigap plan is gonna follow you throughout the country. You can seek services anywhere that accepts Medicare assignment. There's not really a network that you have to stay within. But now we're going to talk about Medicare Advantage plans and some of the major differences that this route has, okay? So the Medicare Advantage route, or Part C, is essentially kind of like the HMO model. So for some of you that maybe you're working right now, or you're still used to your group health plan through your employer, you know, that's what I have. I have to stay in my network. I can't just go wherever I want to. I have to stay within my network. I have to see my primary care physician. I have to go to my pharmacies that are in my network, all these things. So let's talk about Medicare Advantage plan. Okay. In this county, we have 55 different Medicare Advantage plans available for us. They all include prescription medications. A prescription medication coverage. Well, all but one Medicare Advantage include that prescription medication. So yeah, all but one includes it. So what the federal government did in 1999, when they started to allow the private insurance companies get involved in Medicare, is they said, okay, you're going to have to, at minimum, provide all of the original Medicare benefits and treatments, and you're going to have to offer it to your Medicare Advantage clients, right? So everything that traditional Medicare typically handles now gets assigned to a Medicare Advantage plan, okay? And again, the Medicare Advantage plan, when we're on Medicare and we have signed up through a Medicare Advantage plan, and you go seek treatment, you want to make sure that you're presenting your Medicare Advantage health insurance card. Don't present your Medicare card, because remember, Medicare assigned all of those services to your HMO Medicare Advantage plan. So make sure you use that card when you have signed up for Medicare Advantage plan. So one reason that Medicare Advantage plans, I believe, are attractive to some folks, and folks tell me, right? They're like, oh my goodness, I have to make all these decisions with original Medicare. I have to buy a Medigap plan. Uh-oh, I can't afford a Medigap plan. oh man, I have to search for a standalone drug plan. You know, you have to put in a little bit more work to make those decisions. And well, I would encourage folks put in more work and put in more due diligence when making these decisions. Medicare Advantage plans, it's kind of all in one, right? It's a one-stop shop. There's no such thing as buying a Medigap plan to help pay for our Part C copays and deductibles. Those are exclusive products, right? You can't have them both. A lot of folks ask me that, hey, Steve, can I buy a Medigap for my Medicare Advantage plan copays? No, unfortunately, we're not allowed to do that. So the Medicare Advantage plans, again, just a reminder, they're offered by private insurance companies. The prices are all over the place. You must live in the plan service area. So in other words, if I apply for a Medicare Advantage plan, I enroll today, maybe that Medicare Advantage plan isn't in all parts of the state, or maybe they're just not covering all parts of the state. If I move out of that coverage area, I have to decide, I may have to enroll into a different plan altogether. So if I move out of a plan service area, I may have to find a different Medicare Advantage plan. Now, so for example, if I'm moving out of California and I'm moving all the way over to New York, the Medicare Advantage plan I have it may be only on the West Coast, or maybe they have an office on the East Coast, but you know, it's technically, you know, out of my service area. So if I move, I need to let them know, and then I need to decide and purchase a new plan that's in my service area, that's in my zip code, that's in my county. Now, just so you know, if I'm on a Medicare, if I have a Medicare Advantage plan and I'm traveling and I have an urgent need or an emergency, there will be coverage. Just like, you know, my insurance right now, you know, me, I have an HMO plan through my job. If I get an injury out of state, I can have that emergency care coverage paid for, or that urgent need paid for. So that will be covered. But if I move out of the service area, I'm going to have to decide and sign up for a new plan. Okay. By the way, Medicare Advantage plans now, folks with end-stage renal disease can enroll into a Medicare Advantage plan. Prior to this year, they weren't able to. Hospice benefits can also be offered as long as you stay within the Medicare Advantage network. So again, friendly reminder, all Part A and Part B benefits are assigned to the Medicare Advantage plan, okay? So we must obtain care and services from the Medicare Advantage plan, contracted medical group. I already went over these things. Deductibles and co-pays are all set by the plan. The federal government doesn't have anything to do with that. One thing I wanted to show you are some of these costs. So these Medicare Advantage plans, they do have deductibles, they do have co-payments, and they can add up for a lot of folks. They do have monthly premiums too, but they also have extra benefits. And I'm going to pull up this Medicare Advantage plan chart just briefly. Now, I know I'm a little bit behind schedule, but I wanted to give you all a visual of this, okay? Now, again, I don't expect you to look at this chart. It's a bit intimidating. I don't expect you to be like, oh, okay, now I know exactly which Medicare Advantage plan I'm going to join based on this chart that I looked at that Steve sent me. No, but let me just show you something, okay? So AARP is selling a Medicare Advantage plan. These are the medical groups we can go to within that plan. So Sutter Palo Alto Medical Foundation, Primary Medical Group of San Jose, SCIPA, SJMG. I can go to a handful of medical groups. If I join this Medicare Advantage plan, I have to pay them $101 a month. Now, I'll take this opportunity to remind you here today. Just because we join a Medicare Advantage plan doesn't mean that we get to stop paying for our Part B monthly premium, or if we have it, our Part A monthly premium. Those never go away. In addition to these premiums here, we also have to pay for our Part B premium, and if we have one, our Part A premium. So you can see some of these Medicare Advantage plans the monthly premium is $0, which can be very attractive to some folks that may be limited on income. Or maybe they think they don't need all that much coverage because they're fairly healthy. So this is an option that some folks may be attracted towards these plans, okay? Just keep in mind, you do have all these co-pays to meet, okay? So for primary visits, we're paying $0 with AARP. If we want to see a specialist, $15. One thing I wanted to show you, and I'm not going to go through all of these, but all of these co-pays, all of these co-insurances, we do have to pay out of pocket. There's no way around it. Those can add up. Some of them do have extra benefits, and by extra benefits, I'm talking about, let's see, some of them have, they include dental or preventative dental coverage. Now, AARP does not have one. This company does. These ones have limited coverage. So, some of them throw in these extra sweeteners. Some of them even also offer acupuncture. It looks like none of these ones do. I mean, there's all these plans that decided to add in various additional benefits. Some offer transportation, maybe to and from your doctor's appointment, to and from the grocery store. Some of them offer healthcare, health club, like, gym memberships. Silver sneakers, I see as a popular one on a handful of these Medicare Advantage plans. Some of them offer yearly over-the-counter stipends, your cough syrup, cough drops. So some of that can be very attractive to folks. And again, it's one-stop type of shop, and some people like that. So those may be some options. You just got to be mindful that you have to stay in their network. Some networks are smaller than others, as you could see. Some of these are very, very new. We don't even have enough information, but you can kind of check these out. Again, they do have various costs for their prescription medications, but I kind of wanted you to get an idea of what some of these plans offer, what some of the costs are. So let me see, I think that was mostly what I really wanted to cover, those Medicare Advantage plans, that they do have extra benefits. I would encourage y'all, I would encourage folks, don't select a Medicare Advantage plan just because they include a dental package. You want to choose, we want to decide how our Medicare is handled based on our health. We can buy standalone dental insurance. Anybody at any age can buy a dental plan that's very affordable. So you can buy that on the side if you wish, but I wouldn't base a decision just because they have a vision or a dental plan. So just something to think about. So some main differences between original Medicare, let's wrap this up. Main differences between original Medicare and the Medicare Advantage are where you can go for care, what the premiums are, what the out-of-pocket costs are. Keep in mind the extra benefits, dental, vision, hearing. When we purchase a Medigap plan, they may use health-related screening questions in order to sell us a Medigap plan. So something to consider. And just to finish this up, this presentation wouldn't be complete without reminding y'all, once you do enroll into Medicare, if you are on Medicare right now, please protect your Medicare number. Treat it similar to your Social Security number. Don't share it with anybody willy-nilly. Medicare is typically not going to call you asking for your Medicare number. There's all kind of fraudulent activity related to Medicare. Last year alone, it was estimated, it was an estimated of $60 billion of Medicare fraud, waste, and abuse. Now we're all paying into this system. I'm paying into this system right now. You've paid into the system. Maybe you're in Medicare right now. You're paying into it every month right now. $148. So just guard your Medicare number. Medicare, Social Security Administration, they typically put those things in writing. They know our Medicare number. They're not going to call us and ask for it. Be mindful of some of these fraudsters that are out there trying to get our Medicare number. I'm not just going to go out and ask you for your Medicare number. Just be careful of who you share it with this point. Create a mymedicare.gov account. It's a good way to monitor any fraudulent activity. What we want you to do is to prevent it, if you can't, we can't prevent fraud all the time. So at least be able to detect it. And then we want you to report it. We do have a senior Medicare patrol within our high cap program. Now they are the liaison between Medicare Medicare beneficiaries like yourself and law enforcement. So we can be victims of Medicare fraud by the internet, as we all should know. Social media, there's no doubt about it. Social media, Facebook, all those things. There's a lot of fraudsters on there. They know where to find folks and know how to get information and know how to use scare tactics, text and telephone calls, mail and print, in person. In person is still around. So again, I think I've kept folks longer enough. So I did just want y'all to be aware of Medicare fraud. It's very nasty. Once you are about to turn age 65, you're going to get all kinds of advertisements in the mail. Everybody's going to want to sign you up for their Medicare product. High Cap is not selling any Medicare products. Be mindful if you're talking to an insurance agent. I have nothing against insurance agents. I have friends that are insurance agents, but they may have a bottom line. They may come with a bias or biases. They want to make commission. They want to sell their products. They may not show you every single option. High Cap is going to show you everything. And then we're going to help you understand it. So feel free to reach out if you have any questions in the future. But I think, Kat, now is a good time where we can stop the recording, and then we can certainly open it up for Q&A. I would like to thank you all for being patient with me. I don't know what's wrong. Usually I'm good with staying on time, but I seem to really go over today, and I do apologize.